Hello, and thanks for listening to this second update on COVID-19, recorded on the 29th of March. The topics I'll be discussing today are the duration of contagiousness with COVID, some questions about the viral load and how important that is, some question about the immunity after you've had it, trying to look at whether we know how this is going to end, a bit about the discussion of people having loss of sense of smell with this infection, a bit more about masks, and also a few more myths to be busted. So the first thing is duration of contagiousness. Now, you've probably heard all sorts of rather horrifying things in the media about the duration that this virus can remain for after someone has it, both in people, where some people have reported that they've had patients who've had swabs still positive many weeks after the infection, but also from surfaces. So, for example, 3 days for things like plastic and metal, and also up to 17 days after people were taken off cruise ships, that they could still find evidence of the virus being there. But before we believe these and start making changes accordingly, we need to ask the question of what type of test was done to show that the virus was present at that time. So there are two main types of tests we do to detect viruses. The first, here on the left, is PCR, and that's what's done in nearly all cases. With this one, the only thing you're looking for is the genetic material, which can be either DNA or, in the case of COVID, RNA. You're just trying to find the right sequence there and see if you can prove that it has been there. Viral cultures are almost never done, but what you do with these ones is you have these cell cultures growing, and you can see in the top picture there's these normal looking cells. When you introduce a sample containing the virus can then infect those cells, and then over time, when it replicates, it will gradually damage the cells, and you can see the cells change from these normal ones at the top down to these damaged looking cells down the bottom, which show that the virus is there, and also show you the virus is still viable. So we do know that PCR can detect non-viable organisms. An example being with influenza. We know from experience that people with influenza are contagious from about 1 or so days before their symptoms start, up to about 3 to 4 days after they've had symptoms. However, if you do swabs and do PCRs on those, you can find that up to 14 days later, which we know is well beyond the period of contagiousness. And it's the same type of swabs that we'd be doing for people with COVID infection. At more extreme examples, some people do tests where they go to plague pits, in this case in Bavaria, where they dig up the bodies of people who died from the bubonic plague or the Black Death, take a sample from their teeth, and are able to look at the PCR test on that to find the type of plague that they had and prove that it was bubonic plague, and then compare it over the three pandemics of plague that occurred through Europe. And another example, over on the right-hand side, we can see the Pharaoh Ramses V, who lived about 3,000 years ago. And when the mummy of Ramses V was unearthed, they were able to find these pock marks on his cheeks, which people thought perhaps represented smallpox. But again, using PCR tests, they were able to sequence that virus and find that it was a very different virus to the modern smallpox that caused a lot of problems in recent times up to the late 20th century. So we know that in these examples, PCR is detecting organisms many hundreds of years or even 3,000 years old, which are clearly not viable. So if we look at the question of what can we say with a bit more accuracy about the contagiousness of this, we know from people that in the people with the standard mild cases, we can find the virus 1 to 2 days before symptoms, and in viral culture studies, it's often hard to grow viable virus after about 7 days from symptom onset. So what we've said as a clearance tool is for people who've had the virus and had a mild case, if the first time that they could be fully cleared is at least 10 days, if they have the criteria of being well for at least 3 days with no fevers and symptoms have resolved in that time. So they have to have had 10 days of symptoms since onset, and 3 of those days have to be completely well with no fever. For people with more moderate to severe disease who are generally going to be in hospital or even potentially intensive care, we would assume that they're an ongoing risk and probably still excreting the virus at that time. What about for surfaces? Is it really 17 days on a cruise ship? So I think really we don't know for sure, but probably it's a little bit of an academic question anyway. I think we just have to assume that any surface that you personally haven't cleaned recently, that there is potential for contamination from that. So if you've touched anything that other people potentially have touched, then assume you could have virus on your hands and just wash your hands before you go anywhere near touching your eyes, nose or mouth or preparing any food. Make sure your washing surfaces and things you can use to wash surfaces are things that contain 70% alcohol or peroxide, or alternatively bleach preparations. But just make sure you do get the bleach preparation in the right concentration, so mixing it with the right amount of water as per the instructions on the bottle, because they do come in different concentrations, so there's not one size fits all if you're going to use bleach to clean surfaces. Then if you're getting things like fresh produce, so your fruit and vegetables, just make sure you thoroughly rinse those. For food that's non-perishable, if you are leaving that out at room air or even potentially in the sun, we know that that's very good at killing viruses over a period of hours, and it's very unlikely that any virus is going to last more than a few hours in that situation. So moving on now, the question, does viral load matter? You may have heard some things on social media about people who get severe disease with this. They had a higher viral load when they acquired it. And this is probably not evidence-based. And so what we do know about viral load is when we look at the swab taken at the start of illness, for the people who end up with the more severe disease, the viral load on their swab at the start was a bit higher than those people who had the sort of more mild standard type of disease. Could we use that to make a prognosis at the start? Probably not, because the difference is not that great. And there's a fair bit of overlap between the two. So it's not enough to say, all right, well, your viral load is really high on your swab at the start, so therefore you're going to have severe disease. So we aren't at that stage yet. What actually does this mean, though? Probably it's more a reflection on how your immune system reacts to this virus rather than the way you acquired it, or if you're in a home with lots of people with this type of infection, which is suggesting maybe that gives you a higher viral load. But I don't think that's the case. We know with people who get HIV infection, before they start on any type of treatment, some people, their immune system manages to control it pretty well, and they might have a relatively low viral load, whereas others don't control it very well, and they have a much higher viral load. And that's nothing to do with how they acquired it. It's just how their immune system deals with the virus. And those with a higher viral load tend to have a more rapid progression of their illness than those with a lower viral load. And I think this probably is like that, in that people whose immune system deals with it better tend to have the mild disease, and then some people are just unlucky with this unfortunate condition. So moving on then to the question of, are you immune after you've had it? Now, unfortunately, the best we can say at this stage is probably. We don't know for certain, because there have been a handful of cases of people reported overseas as having a reinfection sometime in the not too distant future after having their first round of infection. Now, we don't have too many details about these people, and it may be something to do with this PCR detecting non-viable organisms down the track, or it might be that they are actually being reinfected. We just don't know yet, but it's very rare. There's been over 600,000 cases, and there's just a handful of these possible reinfections. So it seems to be not a common thing anyway. So we would assume you're probably immune, and with viruses like this in general, certainly for months you're probably immune, but probably not for years. The virus will change over time, but we don't know exactly how much that's going to affect it. So we'd say certainly, at least in the short terms, as in weeks to months, you're almost certainly immune, but we don't know exactly how long that's going to last. Can you get a blood test to show you've had it if you had a relatively mild condition and you didn't get a swab done at the time? That is coming. It's not widely available yet, but it's certainly starting to come, and possibly that will be used to say, okay, you've had it, you're probably immune, and you're relatively safer to go out now. But we're not quite there yet, but that's potentially something that we will do down the track. Then moving on to the very difficult question of how this will end. Well, now, obviously I don't know the answer to that, but it depends really on how we tackle things from here. If we do a complete lockdown, and we've seen that in China, where it was a very strict lockdown, obviously backed by their very large power to do that, then they were able to get control of this in a matter of weeks. And so if we did a complete lockdown, probably it would take the time for the virus to transmit within households. And so if one person in the household's got it, then potentially there's a risk of passing on to other ones within the household. So you'd probably want to wait at least 4 to 6 weeks to think, all right, a complete lockdown is going to stop this from being such a problem. If we do more of a partial lockdown, like we've been seeing in the last week or so, that's probably not going to be enough to control this. And so therefore, the curve is not going to be completely flattened, and we will just partially flatten it. And so it will go for quite a long time, but how low is very hard to predict. If we do no lockdown, well, I don't really want to think about that, because the consequence of that is probably too horrible to think about. So let's just let that one go. Now, on this question about loss of sense of smell, so some people are reporting that when they first developed symptoms of COVID, they did lose their sense of smell. And this appears to be in around roughly 1 in 3 people have this. So if we see someone whose symptoms at the time are consistent with COVID infection, and they say, oh, and by the way, I seem to have lost my sense of smell or possibly my sense of taste as well, then we say, all right, yeah, well, that's interesting. And that may well reflect COVID infection. And you definitely need to be in strict isolation because, yep, there's a fair chance you're going to have it. We don't see that all that often with other viral infections. However, if you say, oh, look, I've got these symptoms consistent with COVID, but I can still smell things, does that mean it's not COVID? No, we can't say that because there's still this 2/3 at least of people who do not have the loss of sense of smell when they have COVID. Now, a bit more about masks and their role. So the really important roles for masks are for the person with COVID when they're in a situation where they're potentially coughing and spreading those droplets containing the virus. We definitely think that's a good way to reduce their spread is to put them in a mask. For the people who are caring for someone with COVID, obviously healthcare workers, that's a very important thing because they're going to get a lot of exposure to patients with COVID in the coming months. And so it's very important for healthcare workers. But if you're in a situation where you've got someone at home who has COVID and they're not able to look after themselves completely, then yes, it would be justifiable to certainly say, all right, you need a mask when you're directly caring for that person with COVID. If you're at home and everyone's well and you wanted to go for a walk around the block just to get some fresh air, as long as you're keeping that 1.5 meters of social distancing, then you don't need a mask. It's not going to add anything to your protection in that situation. It is really unnecessary. However, if you're in one of the high risk groups, like someone who is older, has problems with high blood pressure, heart disease, diabetes, or a weakened immune system, and so forth, and you're going to somewhere where there's going to be a crowd. So, for example, if you're heading to the supermarket and you know there's lots of people there at that time, then you could justify using a mask in that situation. But for the most part, we say, right, try and avoid those types of circumstances as much as you can and see if you can get someone who's not in a high risk group to go and get the food for you. Or alternatively, use a home delivery service if you can get access to that. Now, masks, how long do they last? That we tended to think not that long before, but we're actually realizing more recently that they do last for quite a few hours. And with the masks used in hospital, they're often used for a whole shift of 8 hours or so. Now, can they be clean? We're starting to realize that there is the potential for doing that. And so there is growing evidence that exposing them to UV light in special UV light containers, or alternatively heating them up to 70 degrees in special types of ovens, is probably going to be okay to clean them. But it's something where we're just going to be potentially doing that more often as we go through a potential surge in number of cases in hospitals, particularly where we can't keep up with the supply of PPE perhaps. So there might be an issue where we do start to reuse some of these things. But if we have enough supply, then we wouldn't be doing this. What about paper versus cloth masks? There was a study a few years ago which compared the two, and it showed that paper masks were clearly better than the cloth masks at preventing infection. And it appears that the cloth masks do get quite wet with the moisture in your breath, and also they do not do a great job of filtering things like viruses. And so if you're going to have the choice, then paper mask is clearly a better option. Now, finally, some more myths to look at. There's frequent ones about sipping water every few minutes to make sure your throat doesn't get dry, or sipping hot soups, or sipping lemon juice. None of these are going to stop the virus from attaching to the lining of your eyes, nose, or mouth. And in fact, I had one patient in hospital just recently who had COVID and had so much water sipped over a couple of days that he ended up with fluid on his lungs and got quite sick because of that rather than because of his COVID. So keep things in moderation. Gargling antiseptic is not going to stop the virus from attaching as well. It's not going to, the virus is kind of not waiting there to be damaged by the antiseptic. It invades very quickly, so this would not work. Vodka is being suggested as an antiseptic, but no, at roughly 40% alcohol by volume, it's not enough. It needs to be at least 60%, and we tend to go for more like 70% for most types of antiseptic solutions. There's also a suggestion that you'll always have a sore throat for the first 2 days, and that's not true at all. There are plenty of people who go through this with no sore throat at all. And then the persisting myth that young people are safe, and we know that's not. So there have been plenty of infections in young people, and even some very severe ones, and even a few deaths in young people. Now, other, not quite myths, but a lot of people suggesting that you can make sure you will be fine if you take lots of vitamin C or zinc with this. we just don't have any data. There have been lots of studies using things like vitamin C and zinc in people with various viral infections. And at this stage, there's very little data to support their use in any of these. No, it's bad to be deficient. So if you've got low vitamin C to the point of having scurvy, clearly that's bad for you. But having a whole lot more than you actually need, it's almost certainly not going to help you. So if you want to take these, fine. It's not going to hurt, but just keep it sensible. It's probably not useful. And we really don't have any evidence that they do anything useful in COVID infection at this stage. And finally, the ERRATUM section from previous talks. In the previous talk, I did make a bit of a suggestion that you're probably not contagious at 7 days. So we now have this rule that you have to make it to at least 10 days to be considered not contagious, and with those 3 days where you are well with no fever. And then in the first talk, I suggested that children of very low risk and possibly not getting infected at all. We are certainly seeing infections in children. They are generally very mild, but there are certainly plenty of cases of COVID occurring in children. So just want to make sure that you understand that, yes, they can occur. And then finally, this is a really tough time. So I'd just like to say thank you to the people who are in isolation with COVID or who are in quarantine because they potentially have had contact with COVID or come back from overseas. So thank you to the people who are doing their isolation and their quarantine properly. It's really challenging. It's very psychologically stressful. And for the people who are doing that and then saving others from getting infected, thank you very much for doing the right thing, because it's really important to help us in the hospital system from having too many cases where we will really struggle if there are too many cases coming in. And finally, if you do have any questions in future for future episodes of this, please do go through the Facebook page and send a message there with questions or potential errors that I've made. So I'll try and address those in future editions. And once again, thank you very much for listening.